Training you have developed,
Yes.
the program. Can you give me a little background of the purpose behind it?
Yeah, well, the work was commissioned through the Correlation Network and through the Eurasian Harm Reduction Network. And the reason for it is because hepatitis C is an infection that affects so many people who inject drugs. There is effective treatment that is out there that we know works for many people and that can prevent very serious long-term consequences. And yet people's awareness of the treatment, their access to it is so poor still. And although there are examples of good practice, like Slovenia, in many countries there is either sort of little or no access to treatment. People are not clear about what is the best practice according to the evidence, and so the training was developed in order to both inform people about what is our current best practice that people should aim for, and also not purely thinking about what is the best practice, but okay, if this is the best practice, how do we get there? Because what advocacy measures do we have to take? How can we change things? If I'm a practitioner, a nurse, a doctor, what should I do differently? If I'm working in a service, what should my service do? Can I change my policies that will increase access? At a national level, should I be lobbying for guidance that is clearer and that, for example, that doesn't exclude people who are active drug users from treatment, which is a stupid exclusion that is not justified by the evidence, but that we still see in some national guidelines. And finally, to think about the international context, the cost of medicines, which are one of the factors that exclude people from treatment because some of the treatments are still very expensive. So in essence, this is what the training is about. It's giving people a very clear understanding, completely up to date about what is best practice around prevention, testing, treatment, not just the clinical things though. Thinking through about living with hepatitis C, the way it affects maybe your relationships, how you negotiate your sexual relationships, how you explain things to your mother, father, sister, children, whether it affects your insurance, whether you can get a mortgage, all those sorts of things, which are also not to do with medical care, but very important in people's lives.
Affect you indirectly.
Absolutely, yeah. So this, in essence, is the training program. Yeah.
And is it free or?
Yes, the resources are all available from for download from the Correlation Network site, and they either are or will be shortly available from the Eurasian Harm Reduction Network website. They are all completely free. They've been developed in a way that tries to enable people to use them at no cost whatsoever, so that they can just take the resources, and if you have somebody who has the training skills, you can use the resources to deliver training to the people who need them, whether that be at a very, very small level, in a small team of 4 or 5 people, or maybe in a large clinical sort of unit with 20 people, or even at a sort of in a large meeting with sort of 100 people nationally. So we've tried to make them develop them in a way that people can so that people can adapt them to suit their immediate local needs.
Yeah. Okay. Yeah. Have you seen any results? Have there been any evaluation of the
impact of the training?
Yeah.
Okay. So at the moment, it would be premature to be able to talk about the impact of the training, because it's the way it was developed. There was an initial training session in Budapest where we had a draft training program, and we consulted very widely with people who were in medical, clinical roles, people who inject themselves, people with hepatitis C, people who are co-infected with HIV, and so that was the very first delivery of it. then we listened to what everyone said and adapted the training in line with what people told us. And now at this conference, we're really just properly launching it. And so we are hopeful that it will have a big impact on the experience of people who inject and their access to hepatitis C treatment and care. But at present, it's too soon to say.
Okay. And this the peer-to-peer education, is that part of the course, the material?
Yes, the materials are developed with a great deal of explanation behind them that allows people with different forms of expertise to draw on them and adapt them for their own use. So although in many situations it will be people who are sort of clinicians who would be using the materials, we know very well that many of the people with some of the deepest expertise about the nature of the infection, how it affects the people's lives, the treatment options, are people who inject drugs themselves. And so there is an enormous amount of important work that's done both at a formal and an informal level between peers, talking about experiences of treatment, what things people should advocate for, what to ask your doctor for, and supporting people in that way. And so it's difficult, of course, to write one resource that suits all purposes, but this was very clearly in our minds when the work was developed. So we hope that we've written it in a way that would mean that peers would be able to use it in order to work amongst themselves in order to improve their access to and experience of hepatitis C treatment.
Okay, thank you very much.
It's a pleasure.